1. Injection site reactions. Mild and temporary reactions may occur, including swelling, redness, tenderness, bruising, stiffness. These effects typically resolve within a few days. 2. Pain or increased discomfort. Some patients experience temporary increase in pain, soreness at the treatment site, pressure, or stiffness. This usually happens in the first 24 to 72 hours as the body begins the healing response. 3. Infection, rare but possible. Any injection has a small risk of infection. The risk increases if the clinic does not follow sterile techniques. Non-FDA compliant products are used. Providers lack proper training. Reputable clinics dramatically reduce this risk by following strict protocols. 4. Ineffective or incomplete results. Stem cell therapy is not guaranteed to work for everyone. Outcomes may be limited if the damage is too severe. The patient has advanced arthritis or structural collapse. Poor quality stem cells are used. The clinic uses unverified products, a common problem. Proper support of the healing and regenerative processes is not provided. Unfortunately, most providers doing stem cells do not provide any supportive therapies or nutrients needed for maximum benefits. Some patients may see only partial improvement and others may need repeat treatments. 5. Inflammatory flare or immune reaction. Stem cells can occasionally trigger temporary inflammation, local immune response, fluid retention in the joint. These reactions are usually mild and short-lived. 6. Risk of poor quality or unregulated products. One of the biggest actual dangers comes from clinics offering fake stem cell products, non-viable or dead cells, poorly processed amniotic or umbilical cord tissue, unapproved procedures, minimally trained providers. Many learn in a weekend course or online. That is not sufficient to learn how to properly perform the procedures. This can lead to treatment failure or complications. 7. Overgrowth or unintended cell behavior, extremely rare. In poorly regulated treatments, especially outside the U.S., there have been rare cases of abnormal tissue growth, uncontrolled cell behavior. These cases almost always involve using a person's own stem cells, non-approved embryonic or manipulated stem cells, not the umbilical-derived mesenchymal stem cells typically used in U.S. clinics. 8. Blood clot or vascular risk, very rare. If stem cells are injected incorrectly, especially into blood vessels, highly inflamed tissue, sensitive nerve regions, there is a small risk of vascular injury or clot formation. An experienced injector minimizes this risk.